Hi, everybody. It's Rose Griffin here from ABA Speech. If you're new here, I'm a speech language pathologist and a board certified behavior analyst. And today I'm talking to you about strategies for progress monitoring in classroom therapy. I went to the ASHA Connect conference last month and we did an SLP roundtable discussion, and it was for school-based therapists. And we each kind of had our issues and things that were little hiccups that come across in our caseloads and what we were sharing. And one of the reoccurring themes that I heard is that it was really hard for speech language pathologists to provide in classroom therapy or push in services. So I'm going to kind of use those to mean the same thing. And how to capture data during those times. And so I sent out a survey to my email followers and asked them what they would want a free email course about. And this is what came up the most, is how to capture data when we are providing services in the classroom. And so that's why I created this, and I hope that you enjoy the information. So I do have a disclosure. I am the creator of ABA Speech, and I do receive payment from the sales of products and courses. Nothing that I'm really going to talk about during this data collection portion of the webinar, but I did want to tell you that up front. So my learner outcomes today are that participants will be able to list 3 ways to provide in-classroom services. So I've been a speech language pathologist now for 16 years, 15 or 16 years. I'm thinking, and 15 years. And I have worked with lots of different students. I've worked in preschool and high school and middle school. And so a lot of the examples that I'm going to be sharing today are my experiences with classroom-based services. Participants will be able to define discontinuous data collection. So make sure that you don't hit the stop button now and say, this lady is crazy. What is she talking about? That sounds like a scary word, discontinuous data collection. That is just the scientific term that we use for the type of data collection that I'm going to talk about today. And I will talk about it in layman's terms. Sometimes we call it cold probe data collection. And so really it's just capturing data on the first trial or the first time that you ask a student to engage in a skill. So if you're working on a student labeling water, the first time that I sit with that student, I ask them, hey, what is this? If they answer it correct, I circle a plus. If they don't answer it, if they answer it incorrectly, I circle a minus. That would be an example of discontinuous data collection. So I could have just put in there cold probe data or data on the first trial, but I wanted to let you know in the field of applied behavior analysis, we call that discontinuous data collection, but it's also just data on the first trial. That's really how I'm going to be talking about it today, but I wanted to give you all the different terms that I'll discuss. So that's what we're going to be talking about today, the meat of the presentation. And how do we define it? I have data sheets for you too, and I can show you exactly how I use them. It's really helped me streamline how I'm taking data when I go into the classroom and how that specific data really helps me when it's progress reporting time. Our third learner outcome is that participants will be able to list 3 opportunities where discontinuous data collection would be functional. So when will I use this, and how do I relate it to what's going on with my caseload now? How is this actually applicable? I want this information to be something that you can listen to quickly, something that you can print out the data sheets that I'm going to send you, and something you can implement the next day. Okay? That's what I want it to be, functional for you. There's so many things that are hard when you're school-based, especially a school-based therapist. There's so many directions that you're pulled, and one of the main things is that we really have to have data. And always I'm thinking about how we can modify and tweak and make my life easier by making it a streamlined process, but also getting that information that I need so I know, is my student making progress? Do I need to modify my teaching so my student will learn more efficiently? So we have to start here. What is classroom therapy? This might be an easy one, but it's therapy that takes place in the classroom. I read a really good article on the ASHA website, and now I'm having a hard time placing who coined this term classroom therapy, but the person was saying, hey, we don't want to say push in therapy. That sign kind of sounds intrusive and not so friendly, like we're just pushing into the classroom. So it's kind of a semantic issue. So we're going to call it classroom-based therapy, which I think has a nice ring to it. So who needs this type of therapy? This will be very individualized, and it's a decision based on your learner's needs. So when you're sitting down with your team and thinking about what kind of intervention does the student really need, some students may need individual services, some students may need group type services, and some students may need services that are provided in the actual classroom based on what their needs are. So why can it be so difficult? And it can. There's a lot of barriers to providing this type of instruction. Time to plan with teachers. Some teachers, and it hasn't really been my experience, but I know a lot of different people have said, some teachers don't really want you in the room, or they feel hesitant to have you in the room. So that might be a barrier. Time to plan with your teacher. If you're doing any type of co-facilitated groups, last year, the year before, I did a group. It was me, a special education teacher, and an occupational therapist. And we planned a group that was for middle school, high school students, and it incorporated academic skills, vocational skills, occupational therapy skills, and communication-based services. And it was really great. It was hard to plan for that. We started in the beginning of the year planning face-to-face. Then once the school year gets rocking and rolling, that kind of time dissipated. And so we used a Google document so we could put ideas. This week we're going to talk about the restaurant unit, and we're going to work on measuring things, or we're going to work on putting on gloves, things of that nature. Stakeholders who prefer traditional services. This is another reason that classroom-based therapy can be difficult. There might be parents on the team or other teachers, educators, other people that think if you're not pulling the student and providing traditional speech therapy pull-out services, that what you're providing is not going to be functional for that student. And we know that that's not true. We know that some students really benefit from these types of services. I love going to the classroom because I can see my students in the natural environment, and that's really, when you're working with older students, that's really where they're going to be. They're going to be in a vocational setting, they're going to be in their classroom, they're going to be in the larger school environment, and that's where they need to operate and apply the skills that you work on with them for communication. That's why that's so very important. And I feel like when I go in, I'm learning so much about the curriculum. If I'm going in to provide classroom-based services for a student who maybe is on my caseload because of fluency or something of that nature, I may observe in science or social studies. And it's really good for me to understand what are the expectations of that classroom, what is going on in the curriculum. I'm always trying to be in touch with the curriculum in the grades that I serve, but it gives me a good snapshot of what are the flow of the class, how is my student communicating, are there things that I can pull and practice with the student and then help them generalize to that classroom setting. Another reason it can be difficult is how to monitor progress. How are we going to take data? And that's going to be our focus today. So what might it look like? These are some ideas of classroom-based services. An SLP seeing a student in the classroom but one-on-one. So some students maybe have a one-on-one work area, and maybe you go into the classroom and you are in the classroom but you're working with the student in a one-on-one area. Maybe that student has a paraprofessional, and the paraprofessional stays for a portion of the time so they can see how to work on different communication targets when the student is not in speech therapy, because that's important too, to generalize skills. It might look like an SLP seeing a student or a group of students in the classroom as a small group. This is something that we do often. Mixed groups. Maybe we're working on social skills. Maybe we're working on generalizing labeling or being part of a group or whatever it may be. And so oftentimes we'll be going into the classroom and we'll just have planned a group. And if we're lucky and staffing allows, we might have a paraprofessional there to help, or the teacher might be there to help or prompt. Things of that nature. Definitely depends on the building. It might also look like a teacher and an SLP or other related service providers, like I had mentioned, facilitating a small group together. So your push-in services may look different. I do tend to work with older students. I do work with some younger students, but in a different type of setting. So your services, if you're working with a preschool age student, maybe it's a center time and a speech therapist is part of the center time and the students are rotating and things of that nature. So it may look different. There are a lot of different examples. These are just ones that I have participated in the past for classroom-based services. Whatever it looks like, we know that we need data. Why is data so important? Data helps us know where our student currently is with their skills. So when we talk about taking a baseline measure of student skills, I might want to know, can my student greet others? Can my student take turns in a group? Can my student engage in developmentally appropriate play or leisure skills? And I'll be able to capture that data when I go into the classroom. I can get a baseline of how are things going right now. Data also allows us to analyze if our student is making progress. This is what's so powerful about keeping data. Oftentimes when you're working with students with more complex needs, the team might be really large. If you're a school-based therapist, you might be working with private practitioners. There might be consultants on the case. There might be advocates that are part of the team. And so the team gets very, very large. I know that in the past when I've been a part of contentious situations, really from an administrative side, I had a job in Austin, Texas as an autism facilitator and support specialist, and I loved that position. And what I would do oftentimes are go to meetings that tended to be quite contentious and just really a breakdown of communication, maybe some philosophical differences on how to do things. But how I always kept things neutral is that I would really support my team, and my team really knew that we needed to take data. When we have data, we're not just a person with an opinion talking about something, how we think the student is doing. We're reflecting back on our data points and saying, well, our data shows us that our student is making progress and this is working. Or, hey, you know what, you're right. The student is having trouble with this. We analyze this and we're going to put some supports in place so our student can make more progress. So our specific data allows us to take some of that emotion out of things that at times can be quite contentious. Data also allows us to analyze, is our intervention effective? Maybe somebody's been working on labeling water for 3 months. Well, that's not good. Are we not working on it enough? Is a speech therapist the only one working on it? Is that not a functional target because the kid really doesn't like water? What's going on here? And it allows us to look at those data points and say, oh, hey, this is effective, this is good. Or we can look at that data and say, ooh, this doesn't look good. We need to put in a troubleshooting step. We need to design this program of intervention to help our student more effectively. And data allows us to plan for functional interventions, right? To help our students increase their communication skills. That's what's so important, that it really takes out the guesswork. And when it comes to that dreaded progress reporting time, that can be really overwhelming for all of us because we have to do progress reports and we have to continue with all of our data. We have to continue with all of our therapy. It can be really hard, but when you're taking real specific data, like I'm going to show you today, I think that it alleviates some of that stress. That's my hope. So first things first, continuous data collection. We may refer to this as trial by trial data. And so if you're working with younger students, trial by trial data might be something that you take for articulation. Let's say that you have a student and they're working on medial F, and you do 10 words and you take data on 10. And so you get a nice percentage there. Now you might practice that sound in that position 50 to 100 times in the session, but maybe you're just taking data on those first 10 trials, those first 10 attempts at making the sound. And so we would refer to that as trial by trial data. Now, discontinuous data collection, which we're going to focus on today, and I'm going to show you examples of, we may refer to this as cold probe data. Data are recorded for a subset of learning opportunities, and that subset of learning opportunities that we're going to talk about today is the first trial. And what that really means is the first time I ask that student to exhibit that skill. So I go back to, maybe we're working on labeling pen, and I ask the student, hey, what is this one? And they say pen. And I mark my little data sheet. I just mark on the first trial, he got a plus. You know what? We're also working on filling in the blank for familiar phrases. So I may have this and I say, I like to drink. And the student says water. Okay, we're working on filling in the blanks when shown a visual, which was the water. Student gets a plus. And we're also working on answering, what is your name? I ask the student, hey, what's your name? Student has no response. Okay, I'm going to mark a little minus sign, which I'll show you on one of the next slides what the data sheet looks like. And then I still continue to work on that skill. I still continue to say, oh, what's your name? Peter. What's your name? Peter. Oh, your name is Peter. That's right. What's your name? Peter. So we're still going to practice that skill because, hey, that's really important skill, a personal safety question, but we're only going to take data on that first trial. And that's what makes it discontinuous data collection. And we could just call it taking data on the first trial as well. So here are some examples. Continuous data collection, trial by trial. Joe will label dog when shown a picture with 90% accuracy. The SLP shows Joe a variety of pictures of dogs because that's my little plug for working on generalization. If we're working on labeling, we want to show more than one picture so the student understands that not just this picture is a dog, but that different kinds of dogs, a little dog, a Chihuahua is also a dog, a poodle is also a dog, a boxer is also a dog. I'm not a dog person, so I'm running out of dog things, but you understand what I'm saying. So the SLP shows Joe a variety of pictures of dogs, and she takes that on each trial because it's trial by trial. And Joe, as you can see, did a really nice job. He got 90%. Way to go, Joe. That is an example of continuous trial by trial data collection. Now, discontinuous data collection, Joe will label dog when shown a picture with 100% accuracy over 3 consecutive trials. So what is that going to look like? How is that going to be different? The SLP shows Joe a variety of pictures of dogs. Way to go, SLP. You have lots of materials. That's awesome. She takes data on the first trial each day that she sees Joe. Joe gets 2 sessions, Monday and Wednesday. So Monday she goes in, he labels dog plus. They're still going to work on all the other things that they're working on, and you can take data on multiple targets this way. It doesn't just have to be one. Wednesday she goes in, shows him the picture of dog, he gets it plus. The weekend happens, yay. Monday rolls around, she sees Joe for therapy, shows the picture of dog, and he gets it. Wow, okay, he's met mastery because if we go back to our goal, it says with 100% accuracy over 3 consecutive trials. And so that means those sessions, or we could actually put over 3 consecutive sessions, whatever would make most sense for you. So that's an example of discontinuous data collection. So why use this data collection method? Cold probe data is less cumbersome. We don't have to have reams and reams and hundreds of different trials. We're taking data on that first trial. It's a plus or a minus, and we can have that written out on our paper and we just circle it. It makes it so easy. Cold probe data can be easier for other team members to capture data. So depending on your district, your classroom, the professionals that you work with, they can take data on how a student is doing with communication-based targets. There's absolutely nothing wrong with that. Are you, as a speech-language pathologist, if that's what you are when you're listening to this, going to take data? Of course you are. Of course you're going to take data on that. But you can train other members to take data because you know what? It's not cumbersome. It's just, this is the skill. I can write it out. I'll show you on the next couple of slides. And then all you have to do is circle a plus, did they get it? Or you circle a minus. And that's easy. It's just that easy. Cold probe data can simplify your progress monitoring system. I know that when I go into a new school year, I think to myself, what worked last year? What do I need to modify? What do I need to tweak? I don't really do to-do lists anymore because I have so many things to do. I can't even make a to-do list anymore. It would take me way too much time. But theoretically, I ask myself, how did last year go? What do I need to work on? Do I need to take some professional development in this area? Am I good with my progress monitoring or my data collection systems? What do I want to modify and tweak? And that's what I'm hoping with this email course, whenever you're listening to it, is that if data collection is something that you want to modify, tweak, try something new that's less cumbersome, but still giving you a good snapshot, that this will be helpful information for you. So a data sheet for a single student. We would use this. We're going into the classroom for a group lesson taught by the teacher, but only one student has speech on their IEP. These are just examples of when you might use this sheet. Now, if these scenarios don't resonate with you, that's fine. There's all different types of reasons to use this sheet. Or maybe you're going into the classroom to lead or co-lead a group, but only one student has speech on their IEP. You go into the classroom twice a week, this is a case example, to help Smith, with his receptive and expressive use of prepositions. One day a week, you see him individually during a center time, and the other day, the teacher leads a group. You write down the preposition you are targeting, and you probe his knowledge of the skill at the start of the group. You take data on the cold probe sheet and bring it with you each time that you see him. And this is what that data sheet's going to look like. We have the student name. We write the skill. For him, it would be the preposition of on, but you could write multiple skills right here on this sheet. And then when you go in to see the student, the first time that you ask them to do whatever that targeted skill is, you just circle. Yes, they got it. No, they didn't. Yes, they got it. No, they didn't. And then you just say whatever your mastery is. Maybe it's 3 days that they need to get it correct, or maybe it's 2 days based on your learner's behavioral history and how they're learning. You have all the information here. You can copy these front to back. I love to put them in my Google Drive so that I can update them right away if I have them for individual students. And I really like to take data with paper and a pen. I have done data through a system and it didn't work for me. I don't like it. I like to feel and touch my data sheets, especially when I go back to progress monitoring. When I sit down to do my progress reports, all my information's here. It's condensed into just a couple sheets. And what's so powerful about this data is that it's very specific. It doesn't say, hey, we're working on prepositions and he got them with 75% accuracy. That doesn't really tell me anything. It doesn't tell me, was he receptively identifying? Was he expressively identifying? And what were the prepositions? That's what makes this data sheet powerful, is we can write specifically what the student was working on. And these data sheets will be in the email if you sign up for this course. Outcome will come the video, and then you will also get the data sheets. So data sheet for a small group. Going into the classroom for a small group lesson taught by the teacher and all students receive speech therapy services. Maybe you're just kind of going in there to be a bit of a prompter and to help facilitate. Or maybe you're going into the classroom to lead a small group and all students receive speech therapy services. This is more what I can kind of relate to. I'm going into a classroom, I'm doing a small group. It's based on skills that the students are generalizing to a group, or it's based on functional skills, vocational skills, social skills. And I have a data sheet, which I'm going to show you, where I can capture all that different data myself. Now, when I work in a public school. I also work in an ABA type program. And so when I'm in an ABA type program, a lot of the students might need more behavioral support. And so when I have people to help me, one-on-one instructors to help with that behavioral support, they're also really good about taking data on their own data sheet, because the students have a daily or weekly data sheet where we track data. So whatever your case is, if you're taking it yourself, this is very doable. If you have somebody else who's taking it for you, that's great too. So here's the data for a small group. Now, when I do my groups, I like to print this sheet out every single week that I do that particular group. And I write down the activities. I like to write that down so I can kind of look at it myself and say, oh, okay, we're going to work on these things for a month. And then next month, we're going to address these, because there's nothing wrong with a little repetition to help drive home some skills. And it also helps me when I'm doing progress reporting to be able to share specifically what we worked on. We worked on Modify Uno. This is how you play it. This is how many prompts it took your student to achieve that. So if a student has a home program at home, which oftentimes students with more complex needs might have tutors and things like that that are coming into the home, or they're going out to outside providers, if you give them this progress report that has specific data, they can really help to generalize these skills to other environments, which that's really what's so important for our students, that generalization piece. I also write the date, obviously. Then I write the students' names. You can capture lots of different students here, what their skill was, and how they did with that skill. Maybe somebody's working on turning the page of a book. Maybe somebody's working on commenting within a group. Maybe somebody's working on responding to a social greeting. Maybe somebody's working on answering a social question. That can all be captured here. And you just look at the first trial and you circle, did they do it the first time or did they not? Not to say that we're not going to work on that skill in subsequent trials, because that's what makes us speech language pathologists and therapists, and helping our student increase their communication skills. But this allows us just to get data on that first trial. Here's a case example. You run a small group for 3 students with moderate autism. You are working on the students filling in the blank for familiar phrases. Josiah is filling in, ready, set, and Bernadette is filling in, you eat cereal with a, and Vance is filling in, I sit on a. You teach your lesson as planned, and when you work on these fill-ins, you document the data with the group data sheet. So everybody's working on something a little different, but you're incorporating it into the group just like we always do. And you're taking data on that first trial that you've asked them by just circling a plus or a minus. So that is it in a nutshell. Some key points: classroom-based progress monitoring. That sounds fancy. Does not have to overwhelm you. You've got this. You can do it. Using a discontinuous data collection method can make the process easier. If you have questions, send me an email at rose@abaspeech.org. I'm more than happy to talk to you about how to implement these in your practice. Thanks for listening. Visit me at www.abaspeech.org for free and affordable speech therapy activities for students who are nonverbal or limited verbally. If you haven't checked out my Action Builder cards, they're really great. I use them all the time. They help plan for generalization. They have multiple pictures of actions: washing, 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 and really cool guided text on the back. I also have a new product coming out this fall called Double Up, which is functional vocabulary / leisure for middle school, high school, and adults even. So hopefully you will love that too. I'm really excited about that. I do take purchase orders, just to let you know, and I hope that you will share this with a friend. If you have somebody who's really struggling with that data collection piece, please let them know that there's an easier way and we don't have to overwhelm ourselves with reams and reams of paper. This is the reference where I used this from the Journal of Applied Behavior Analysis to get some of that information. As always, thanks so much for listening. If you're on my email list, thank you so much for being here. I really appreciate your support. If I can help you take actionable steps to use this in your daily practice, don't hesitate to contact me at my website or at my email, rose@abaspeech.org. Thanks so much. Have a good one. Till next time. Bye.